Graduate of St. John's. He is a proud graduate of St. John's College in Nassau, Bahamas, and Acadia University in Nova Scotia, Canada, where he double majored in biology and chemistry. Dr. Bonimy received his medical degree and specialty training in internal medicine at the University of the West Indies, where he was appointed chief resident in medicine. Following residency, he completed a fellowship in infectious diseases at the University of the West Indies Faculty of Medical Sciences in conjunction with the University of South Carolina School of Medicine and the University Health Network Transplant Center in Toronto, Canada. Dr. Bonamy's list of services cover the prevention and management of chronic and complex medical issues, including high blood pressure, diabetes, high cholesterol, heart disease, and a full spectrum of infectious diseases, including abdominal infections, bone and joint infections, liver infections such as viral hepatitis, pneumonia, tuberculosis, sexually transmitted infections, skin and tissue infections such as diabetic foot, and vaccine advice to international traveling patients. Dr. Bonamy is the president of UR Health System of Care and director of the Internal Medicine Associate Group, Nassau, Bahamas. Additionally, he serves as a consultant in infectious diseases at the Princess Margaret Hospital and Doctors Hospital. He is a member of the Medical Association of the Bahamas, the Infectious Diseases Society of America, and the Society of Healthcare Epidemiology of America. Please let us welcome our esteemed guest, Dr. Charlion Christian Bonamy.
Okay, Dr. Bonamy, I will allow, yes. Yes, you may go ahead now to share if you wish. Am I hearing you? You're good, Dr. B?
Hi, good afternoon.
Yes, good afternoon, son.
All right, just looking to share my screen here.
Did you get through? I clicked OK.
Okay, let me try again.
All right, let me try from my side as well. I okayed it. Carol, can you get Dr. Bonamy to share screen, please?
Give me a sec, let's see.
Yeah, it's on multiple can share.
Try again. Are you seeing?
Oh, let me stop my share.
Oh, yeah, sorry, yeah.
Okay, sorry, stop the share. Go ahead. Sorry, Dr. B.
You guys can see it?
Yep.
Can.
All right. Good afternoon, everyone.
Good afternoon.
St. Ambrose. I firstly want to thank the Pastoral Care Ministry of St. Ambrose for inviting me to present to you this afternoon. Ongoing educational activities and seminars, especially in the church setting, is something that I've always been passionate about. Healthcare is my Christian ministry and certainly one of my contributions to the body of Christ. So being able to share my knowledge and experience with you all, I'm very appreciative. So we'll talk about COVID-19, where we stand today and future directions. It's kind of hard to talk about where you currently are without thinking about, where you came from. And every now and then, I reminisce on the days and the weeks when COVID first appeared on the global radar as this strange new virus that was spreading throughout Wuhan, China. I'm sure many of you can remember how mesmerized and on edge you may have been each day watching the news channels and witnessing the case numbers from one country to the next rise, watching the death rates, watching what other nations were doing as it related to lockdowns, and if the Bahamas was going to get hit. And if so, what to expect? Well, here we are, over 4 years since COVID-19 made itself known. And as of April of this year, we've had over 700 million confirmed cases and over 7 million deaths. In the Bahamas, we experienced roughly over 38,000 confirmed cases and over 800 deaths. Now, these case numbers are most certainly underestimated because it doesn't account for people who actually didn't test, who didn't have symptoms. Also, we've actually stopped recording COVID cases as of April. As you may have been aware, the WHO ended the international concern mandate. And so countries stopped reporting cases for the most part. So it truthfully puts into perspective, the ability of viruses, these organisms that we honestly can't see with our naked eye, to spread and multiply despite our best efforts. It helps us to realize how vulnerable we are globally as it relates to these infectious diseases. Despite the strict lockdowns, public health measures, vaccinations, our prior knowledge and experience with past pandemics and infections, COVID-19 was still able to infect or impact most, if not all of us. It also highlights how really interconnected our world is. What was happening in China happened in Europe, the US, happened in Canada, it happened in the Bahamas, it happened in the rest of the Caribbean as it relates to case increases, case deaths, and so on. When they had a wave, we had a wave. When there were rising death rates in other places, we were experiencing the same thing. When cases declined elsewhere, so did ours. This here I put up as a graph, just to give an illustration really as to the increase and decline, what was going on in the world and what we were seeing home. As you can tell, very similar, very, very similar. And the same goes for the recovery rates and the death rates. Very similar pattern, which pretty much highlights, the essence of how a pandemic responds and behaves. These COVID waves were and still are the result of the emergence of COVID variants. The variants have played a crucial role in the evolution of the virus and this pandemic. The degree of variance from what we have seen with COVID, we've honestly never seen before. At least it's not been recorded. In fact, at the beginning of the pandemic, most virologists didn't feel that the variants would have played a significant role. It so turned out that they obviously were wrong. And the variants to date have played the biggest role in every aspect of this pandemic, from symptoms, transmission, testing, treatment, our public health measures, our vaccination efforts, and vaccine effectiveness. You cannot tell the story of any of those categories without a focus on the variants. The variants, what they are genetic mutations in the virus as the virus replicates. And some of these mutations, they give the virus an advantage, such as the ability to evade our immune system. Others give it the ability to be transmitted more easily. And unfortunately, some mutations cause the virus to be a bit more deadly. What we are seeing today is the emergence of variants that result in the rise in cases every few months or so. There hasn't been a seasonality like the flu. We expect the flu to pick up, in the winter season. But every 2-3 months, we are seeing COVID cases rise and fall. Case in point, in June, which was just 2, 3 months ago, the world experienced a rise in cases due to a new variant that led to increased hospitalizations and some deaths in areas. And now, just within the past few days, we have the emergence of another new variant. Look at the article here on the right. This was actually just published 2 days ago. A brand new variant emerges just a month or two after one declined. So far, we know that the majority of these variants, particularly in the last 2 years, have mostly led to mild to moderate illnesses, symptoms like your common cold, although there are some people who have become very ill and had to be hospitalized. What this new variant, this XEC variant, is doing or going to do remains to be seen. So something we definitely need to be vigilant about as a community. The deadliest variant to date was the Delta variant, which occurred at least on our borders around the end of fall 2021. It led to more severe lung disease and death than any of the others. And so monitoring what is going on as it relates to rising cases, hospitalizations, severity of illness remains very important as it relates to our public health response. During the first waves of COVID, our health systems were challenged significantly, and each variant presented a unique challenge to our health system. Our hospitals in the early phases became overwhelmed. Our workforce was exhausted, and COVID pretty much halted routine medical care. There was a surge in patients requiring medical care, especially for COVID-related respiratory illness. We had more patients, though, who needed ventilators than we had ventilators. And, although the Almighty grants us free air to breathe, oxygen during that time was a luxury for many folks. We had significant bed shortages. Our general floors were transformed into ICU units, especially during the Delta wave. I had colleagues who honestly couldn't bear it. Some of them decided not to work and just bunker down until the all clear, which was understandable if you can imagine what was going on. So many of them actually left the healthcare field, and this happened globally. COVID became priority over other illnesses, and facilities couldn't afford the risk of doing routine things such as mammograms, pap smears, and colonoscopies. So naturally, without these screening tools, cancer would be missed, and unfortunately, cancer rates go up. So it highlighted significant gaps and vulnerabilities in the way we routinely deliver care and our public health infrastructure. In the initial phase of the pandemic, we couldn't even test for COVID efficiently. Imagine finally getting a test and then receiving a result 5 days later. So we had really significant health system challenges from the get-go. The public health measures employed did provide us with time to attempt to get ahead of the virus. Mask mandates have shown and continue to show reduced transmission of respiratory viruses, which are a big reason they are still very much used daily in our hospitals and are certainly advocated to help prevent or spread infection in public spaces. Social distancing when you are sick, washing your hands, they were and still today are very important. Quarantine and isolation was also very important in the first waves of the pandemic. Now there isn't a need for this given the widespread of COVID cases and immunized people. There isn't a reason for quarantine and isolation. Obviously, the public health system faced many challenges. Vaccine hesitancy was and still remains a huge challenge. The spread of misinformation has definitely helped or contributed to that, but also fear, uncertainty and trust or mistrust in the health authorities, as well. Additionally, people get tired. I mean, each day, every day, all you heard about was COVID. And then on top of that, folks are locked down in their homes. They can't see their loved ones. They can't gather for mass or the fellowship in church. Imagine that. So undoubtedly, fatigue and disinterest is going to happen. On a global scale, we've had unprecedented economic disruptions affecting sectors such as travel, hospitality, and retail, triggering recessions worldwide. We've obviously seen the counter to that now that the pandemic is done and the uptick in travel globally. The impact has been far-reaching, though. We've had surging unemployment, leading to increased financial insecurity for individuals and families. We've had supply chain disruptions causing delays and shortages of goods. We've had a shift in consumer behavior. My wife, for example, she still shops mostly online, which I account for my hair loss over the past few years. So a lot of things has occurred from a global and economic standpoint as it relates to COVID. I wanted to kind of highlight the impact on children and schools. Even though children generally have milder symptoms, schools have certainly been affected by closures and remote learning, impacting education and social development. School closures and remote learning actually became the norm in many places. This is a picture of my 4-year-old son at the time and my 2-year-old daughter sitting at a table in the dining room that we had put together. And, each morning, my son, who then was in pre-K, he had to dress up in his school uniform, while my wife would painstakingly have to sit there to make sure that he's focused, that he's listening, he understands, that he can hear the assignment, hear what the teacher is saying, be engaged in what's going on that 8 by 5 inch tablet screen every day for hours on end. And at the same time, she had to entertain my 2-year-old daughter without causing a disturbance or distracting what he was doing. And I thank God for her diligence and commitment to that, because I honestly don't know how she did it, because I honestly couldn't do it. I don't know how it was possible. And I can imagine, or you can imagine, the amount of families, children who didn't have that ability um, or that opportunity, even as something as simple as the technology, the tablet, no internet, electricity, or even to even attempt that. And so there was certainly a shift to this online education, which highlighted this digital divide that we talk about as a result of these disparities in access to technology. Certainly students from low-income families, they were particularly affected, lacking the necessary resources for learning. And children missed, on top of that, they missed essential social interactions that were crucial for developing social skills. The lack of face-to-face interactions with peers and teachers hindered their ability to build relationships and navigate social situations. So with remote learning, also children experience increased screen time, right? And if you're a parent who have a child who has a tablet, you know the importance of limiting their use on a device. This has now raised concerns on the impact on physical health, sleep patterns, and overall well-being. Not to mention parents and caregivers who also face, with challenges, having to balance work with homeschooling and family responsibilities, which obviously added stress to the family dynamic. So the learning disruptions could have long-term consequences on educational and future opportunities for children. Last but certainly not least, I just wanted to touch on mental health impact of COVID-19. The pandemic has significantly exacerbated mental health issues globally. We are seeing increased anxiety and depression, obviously due to the uncertainty of fear of infection and concern for loved ones. That was pretty high at the time and is still ongoing. I have seen people then die from the fear of knowing they had COVID from COVID itself, right? So mental health plays a very important role in our health. Social distancing measures and lockdowns have most certainly resulted in increased feelings of isolation, particularly among vulnerable populations like the elderly or those living alone. The pandemic has led to an increase in substance and alcohol abuse as people have turned to drugs and alcohol as coping mechanisms. Workplace mental health has also been a concern. Folks would come to you for sick slips because Mary in the next cubicle was coughing, right? And that continues today. So anxiety about who is sick in the work environment, the effects of working at home, they all come into question. The mental health impact of the pandemic is likely to be long lasting, with many individuals experiencing ongoing challenges. So it's definitely important for the pastoral ministry of St. Ambrose really to be aware of the impact and ongoing challenges that the pandemic has had. And there's certainly much more that truthfully we can unpack, but we don't have the time constraint. We have time constraints, but there's a lot of work to be done. A question I get all the time is, how do I know if it's COVID versus something else? And the truth is you honestly can't put COVID in a box. We are all different. We all have different levels of, or different genetic makeups. We have different levels of immunity. Some of us are vaccinated, some of us aren't. And then the variants, they carry their own unique characteristics. Some patterns, however, do occur.
What?
In the early stages of the pandemic, common symptoms included fever, cough, difficulty breathing. Other symptoms like fatigue, body aches, sore throat, loss of taste or smell were also frequently reported. As new variants emerged, reports showed variations in symptoms and severity. Example, the Alpha variant was similar to the original strain, the one that started off in March 2020. However, the Alpha had a higher amount of sore throat and headaches than the original. The Delta was associated again with more severe illness and symptoms such as high fever, cough, loss of smell, along with diarrhea, so GI symptoms. Omicron shifted with more sore throat, congestion, and fatigue. Then you had people who didn't have any symptoms, who had COVID and were able to transmit the virus, especially with the Omicron variant. Children were affected differently. Severe cases in children were pretty much rare. The ongoing evolution of the virus requires, though, continuous monitoring of symptoms associated with the new variants. So if someone comes to you and say they know everything about COVID and how to diagnose it and treat it, beware of them. The variants and paying attention to how they behave again right now is the key to all of this. And as we have seen, they continue to emerge and evolve. So there's really no final answer at this time. After infection and recovery, there are and were many patients who continued to experience what we call long COVID with symptoms such as chronic fatigue, forgetfulness, difficulty concentrating, sleep disturbances, heart and stomach issues, and mental health conditions like anxiety and depression, along with shortness of breath that lasted months after recovery, almost up to a year or two. And this phenomenon actually isn't new to viral infections, especially not viral respiratory infections. We've seen it a few occasions with influenza, but we have never seen it at the magnitude that we've seen with COVID-19. Currently, there is a lot of research into the area of long COVID and into what measures have been shown to reduce the occurrence of these persistent symptoms. So who should be concerned as it relates to, the direct health impact of the COVID-19 virus? Even before COVID, we have known that there is a strong relationship between infectious diseases like COVID and flu and chronic non-communicable diseases like high blood pressure and diabetes. The rule of thumb is the more chronic diseases you have, the higher the chance you will have a bad outcome if you get a bad version of COVID-19. So the elderly, defined as people over 65 years, have had worse outcomes once they got COVID-19. Those with chronic conditions such as diabetes, heart disease, respiratory diseases like asthma, COPD, chronic smokers, obesity, and I'm sure many of you have seen where we rank in the world as it relates to obesity. But obesity carries a very significant risk of a bad outcome if you're infected. High blood pressure, they all carry higher risk of worse outcomes in people who contract COVID. Our data on hospitalizations and our deaths are clear that those who suffered more during the pandemic had these underlying health issues. Those who already have a weak immune system, such as those with HIV/AIDS, those on dialysis, those with autoimmune diseases such as lupus, rheumatoid arthritis, they're at increased risk for worse outcomes, along with the people with disability and women who are pregnant. All of them, they fall into that high risk group. Perhaps the most glaring evidence against protecting persons who are high risk has been vaccines. Vaccines have provided and continues to provide strong protection against severe illness. They, however, are not foolproof. We have seen breakthrough infections, transmissions. We have seen vaccinated people with severe illness and who have died. But the overwhelming evidence points to vaccination causing an enhanced protection and a decrease in hospitalizations and death in high-risk people who are vaccinated. Additional doses or boosters are recommended for those whose immune systems are weak, as well as the elderly, to maintain adequate protection. Vaccine immunity, it decreases over time, especially for certain vaccines. Also, new variants of the virus may partially evade the vaccine immunity, which puts us, at somewhat of a quagmire, because the sooner you make a vaccine or you ask someone to take a booster, a new variant can come out with the potential to evade it. And so public health recommendations for booster doses may vary based on factors such as, vaccine, the person's risk level, and the emerging data on the variant of concern at that time. So when navigating this space, it's important to know your risks. Do you fall in a category that puts you at significant risk of a bad outcome or not? If so, vaccination helps. It's important to stay informed, keep up to date with public health guidelines and recommendations, monitor your health, and stay vigilant regarding any worrying symptoms of COVID. It's important to communicate with your healthcare provider. Discuss individual risks with your physician and about any concerns with COVID-19. Each person is different, and in my experience, personalized advice is best. Be prepared. Have a plan in place for potential illness, including access to medication, food, and various support systems. I can't tell you how often I see patients uh, with their family members not knowing what they would want for them in the case of a crisis. So take these proactive steps, especially high risk and vulnerable groups, to navigate the um, ongoing challenges posed by COVID-19. Another important step is to take control of your health, any chronic medical illness that you may have. If you have disease like high blood pressure and diabetes, do what you can and are supposed to do to have control over them. Infections typically will hit before you know it. So don't be caught off guard. By the time you have symptoms, probably been infected for about 2 to 3 days. So don't be caught off guard with your chronic illness out of check. Take your medications, prioritize health now. The pandemic has certainly taught us the importance of preparedness. It has highlighted the necessity of robust public health infrastructure and preparedness plans to respond swiftly to emerging infectious diseases. It has taught us the value of vaccination as a critical tool in controlling spread and reducing severe illness, especially in the most vulnerable patients. It has revealed and exacerbated existing inequalities in healthcare access and outcomes, emphasizing the need for equity in health systems. It has taught us the importance of clear and transparent communication from public health authorities. And despite the dark days, as a community, we are pretty resilient in adapting to and facing these challenges and learning to respond to the evolving circumstances effectively. So, in conclusion, as we navigate the future, global vaccination, new treatments, and preparedness will pretty much determine the course of COVID-19. It will require a multifaceted approach that balances public health, economic recovery, and individual well-being. Continuous monitoring of the virus and adapting our response will be essential. Strengthening our healthcare systems and infrastructure will be crucial to handle future outbreaks and to ensure equitable access to medical care. Encouraging community involvement and public awareness, emphasizing and prioritizing mental health resources, and embracing hybrid models in workplaces and educational institutions, kind of like what we're doing this evening on Zoom. These can lead to more resilient systems that cater to the diverse needs that can be unearthed with any future events. And I'm going to end there. I thank you all for listening.
Okay. Want to thank, at this time, we want to open the floor for questions for anyone who has any special, anything special or would like to ask. Please now, the floor is open for questions or comments.
Good
I
evening.
have a question for Dr. Bonimy. Dr. Bonimy, it's little past 4 years since the pandemic began. Is it possible to have long COVID up to today's state? Because
Well,
I have a relative who hasn't returned to normal since he had a COVID-19.
yeah, I would not rule that out as impossible. I've seen so many things that happened with COVID. So one of the things I've noticed or saw while taking care of COVID patients is that it unmasks certain medical illnesses that we actually didn't know we have. So, for
Okay.
example, people would come in with a heart attack, or they will come in with elevated high blood pressure, or they
Mhm.
would come in with diabetic emergencies, and they were never known to be diabetic. They were never known to have high blood pressure or never known to have heart disease, but because they were never diagnosed with it. But what I've realized is that what the infection did was it unmasked a lot of those underlying things. So it really and truly depends on what your family member is going through, even certain mental illnesses, right? So
Mhm.
I've seen patients who were diagnosed with schizophrenia um, after they got COVID, but they had a risk factor for being schizophrenic, but it never really played out until they got the infection. So I wouldn't say that it's impossible. I don't think that we have the definition um for a 4 year long COVID. We could say that it can last up to a year or so, but I don't know if that has been defined as yet. But I wouldn't say that that's impossible to happen.
Because he seemed to have had a stroke and
Yeah,
to be in early dementia.
yes. I've seen individuals whose presenting symptom of COVID was stroke, right? I've
Okay.
seen it. Yeah.
Okay, thank you.
Gwen, you had a question?
Yes, good evening all. Dr. Bonamy, you mentioned lessening the socioeconomic disparities. How do we do that?
I wish I knew. That is obviously a very loaded question that I myself, as in my role, could only play my part. I honestly think that is something that everybody, a role, every or part everybody has to play. Everybody has to play a part with regards to access to individuals who can't afford appropriate health care. I know the government, they rolled an NHI plan. How effective that is, it remains to be seen. Strengthening our public health, healthcare facilities, investing more in physicians and healthcare workers who want to be there. So improving the access of healthcare, that's just only one aspect of it, right? And we talk about the financial aspect of it for so certain people they don't have appropriate resources. Some people don't have internet, some people don't have electricity. We see that teachers are leaving the school, so there's a lot to unpack in that. And I think it honestly takes the global community to address it.
Thank you.
Joel has his hand up. Joel,
Yeah,
go
Dr.
ahead.
Barnaby, yes. Do you see any disease like this or any other disease similar to this happening in the near future the way we had COVID?
So it's tough to say. So we are seeing an increase in diseases, infectious diseases, more so than before. Right now, honestly, you saw monkeypox on the rise, which was just termed a public health emergency of international concern a month ago. We had monkeypox in 2022. There's a new arbovirus or mosquito-borne virus that we're seeing rising in the United States, in Cuba and the Dominican Republic. We've had cases of dengue. We know that there is a avian flu outbreak right now in the US that seems to be causing some concern. So I definitely do believe we are going to see another pandemic. Obviously, if Christ not come. So it is important for us, important for countries to just kind of be prepared. So I wouldn't put it past, because we are seeing a rise in these infectious diseases more and more.
Thank you.
Is there anyone else who would like to comment or ask a question?
Dr. Bonimy, we learned some good stuff from COVID, okay? I think people realized that they didn't have to stay in a brick and mortar to be effective. I know that a lot of people didn't really adopt that thing in the Bahamas because we believe in going to the office. But I think we learned that from there. But tell me, did our local doctors and the Ministry of Education actually come to a compromise as to if something similar arose again, how they would react? Simply because you mentioned your personal experience, and I think nationally we all can see some of the fallout on an already failing educational system. Have the powers that be within our country actually used or met to discuss what was determined internationally to be the force that deals with that educational part, so that we don't have that same type of fallout?
I honestly feel that if something similar was to happen, I believe, say COVID happens again today, and we didn't know about COVID, right? We didn't have vaccines and that sort of thing. I believe we are a bit more prepared, but I don't believe that we are prepared enough to prevent any serious damage. I do believe we would still be impacted quite similarly to what's been going on the past 4 years. So I honestly don't feel as though, and where that, what that standard is, I honestly can't say. But even today, we still have bed shortages in the public hospitals. We still have clinics that are seeing 40 to 50 patients in the public sector every day. We still don't have enough physicians and nurses. The nurses are, some of them are leaving for better opportunities abroad. So, you know, we're still not where we need to be. We still would take a serious, very serious hit if we have another pandemic, say similar to COVID. I think we've made some improvements in our healthcare aspect, though. We have more isolation rooms, but is that enough? It's hard to say. We have embraced technology a bit more, so that helps. Um, have have we addressed the whole thing about access of, you know, students to technology? So I'm not honestly sure that we're where we need to be, but we've made some strides.
Thank you. Carl Roach, hand up.
It's not a question, but I had to, as my former capacity in government in the IT department, when there was a call for nurses and doctors to come in and bring their own laptops so that we can track and do other things, whatever it was they were doing with COVID. I just commend the medical profession, the healthcare profession. It was something to see. People just came in, they signed up, they were willing to use their own laptops and devices in order to see this country through. So I just want to thank you and the healthcare professionals. Job well done.
Thank you, Ms. Roach. And I think it also speaks to us again. We are a very resilient community, right? So and we're able to adapt and evolve. So COVID was brand new, brand spanking new. No one saw it. Um, no one read about it. You know, I didn't read it in a book. No, you're unable to prepare for it. And we did what we had to do. We adapted, we moved on, and you know, we're in a better place still today. So thank you for that.
I
And
just
Dr.
also
Bonimy,
like to add that we were the first and best in the Caribbean in handling it. I have cousins in Trinidad, and it was amazing the hoops that they had to jump through in order to get a vaccine. It was just incredible.
and for Dr. Bonamy, there's a question here. Has there been a link between the COVID vaccine and an increase in cancer? One of the participants is asking that question.
There hasn't been a link between COVID vaccine and cancer. There has been links between COVID-19 and cancer, but there hasn't been a specific link COVID-19 and cancer. Now, sorry, the vaccines and cancer. Now, I'm not saying that the vaccines aren't 100% safe. Obviously, we've had small cases of cardiac inflammation in men under 45 years of age who took the vaccine. And then there were some small cases of stroke in, I think, middle-aged women at the outset. So they're not 100% safe, but they have been shown to be safer than, say, you contract COVID-19. So your cardiac inflammation, if you get COVID-19, is significantly increased, or much higher than if you take COVID-19 vaccine. Or your risk of stroke is significantly higher if you get COVID-19 than if you take the COVID-19 vaccine. But no, there hasn't been a link, direct link between COVID-19 and cancer. The vaccine and cancer, sorry.
Good, thank you. Someone commenting here, very comprehensive and enlightening prevention is coming up in the chat. All right. Is there anyone else who wants to comment or ask a question, please? Please, now is your turn. All right. Doctor, my former student, oh, there's somebody here. Charlian, that is Mrs. Hannah here talking to you here.
Okay.
Is there a national report? The question has come up. Is there a national report wrap up on COVID? In other words, I guess, is it finished? Is there a national closure to it yet?
Not at this time. We are still seeing cases. We are still seeing new variants. The book hasn't been closed on COVID as yet.
Unending, yeah.
And the recommendation is still for persons to get the vaccinations. And another question in reference to the follow-up vaccinations that you get. How highly is that recommended, or what has been the feedback as to the effectiveness of getting a second and third vaccination, say, every other year?
Right. So my advice is to know what your risk is, right? Those at high risk. So those who are over 65, those who have weak immune systems, the risk for them becoming severely ill with COVID is higher, obviously, than those who are, for the most part, healthy. And so we have found that vaccines have been shown to reduce the risk, especially in high risk groups, um, of severe illness and hospitalizations. So I always tell folks to make sure, know your risk, speak with your physician, your primary care provider, to determine, should you be vaccinated? Also, because they would also know, well, what's the current status of COVID in the environment? What's happening now? What are we looking with regards to vaccination? Are they still doing variant specific vaccines, or is there a pan vaccine that we can do? Is there a new variant that's on the rise that has been shown to evade the vaccine that I want to get? So know your risk, speak to your provider, and to me, that's the best advice.
Okay, there's a question. What is the current treatment for COVID?
Right. So treatment is so we have not been good as a medical community with regards to treating any virus. Treatment has been more so studied in persons who have been hospitalized. There have not been any, knock out of the park antiviral medications or agents that have shown to be effective or that effective in persons with just a mild to moderate illness. So someone who doesn't come into hospital, right? So there haven't been, because at the end of the day, if the illness is already mild or moderate, you get over it in any event. But once you're in hospital, there are more high-grade medications that we can give. So, for example, one of the phases of COVID is a severe inflammatory phase that the individual gets into. It's a very bad lung inflammatory phase that happens usually about day 6 um, in 6 of infection. And we've been shown that if we give a patient steroids or corticosteroids during that phase of treatment, their outcome is better. Making sure that they're on appropriate oxygen support, making sure that they are on appropriate blood thinning medications so that they don't develop any blood clots in the lung or blood clots in the leg. So until the course of the disease till it has been completed. And
Okay.
then you have some antiviral medications, but they haven't been shown to be that really, effective.
A double question here. Are we keeping healthcare statistics and are we tracking the residual effects or conditions of individuals? I half answered, I think.
So we've stopped tracking case numbers. We've honestly went away from testing. I don't know when the last time we've obviously heard somebody got tested for COVID, right? So we are not, every now and again, our hospitals might test you, but they're not being reported as of April of this year. Sorry, what was the second question?
The second part was, are we tracking the residual effects or conditions of individuals?
So as a country, I don't think we are, but the WHO and CDC have a tracking system as it relates to long-term effects as well as vaccine-related effects, which is
Dr. Bonimy, I have a question again.
Mhm.
I'm a Bahamian, strictly Bahamian this time, and I know the medical professionals don't particularly care for this question, but anyhow, I asking it. We like bush medicine. Did or does the medical field actually recommend bush medicine? And if so, what is it that they would recommend?
You talking specific to COVID?
The COVID.
Yeah, it's hard to say. I honestly have no I'm not against bush medicine. I think bush medicine is pretty good. I've taken bush medicine quite a few times for sickness. Which one I can't say, But what I always tell patients is we don't have any, real scientific studies on bush medicine. We don't know how bush medicine, how much bush medicine you should be taking. We obviously know too much of it is not good for you. And then also you don't want to take medications that might interact with some of the medications that we give that we know um, or have proven to work because they can cause, liver issues and kidney issues. So I'm very cautious about saying what bush medicine to take because I honestly can't say or how much you should take.
True to form. That's normally the medical response that one would often get, because we don't measure it, then we shouldn't use it. But our locals, you know that some people have showed up at the hospital after saying they were self-medicating and they were using the bush medicine to do so.
Oh yeah.
So that was why I asked you that question,
No.
because I know plenty of people on this line, on this call, they try some bush medicine. Somebody told them will work if they had COVID or thought they had COVID.
Yeah, I mean, and it is certainly cultural. I've had to take care of doctors who end up with liver failure because they were self-medicating with bush medicine. So I know.
Okay, and a question here. What is Mimi? What is the protocol once exposed to COVID in the workplace or community? Is there still something in place?
Yeah, so protocol isn't a community protocol, but obviously if you have fever and are feeling bad and are coughing, you don't want to spread it to anybody. So I would advise you stay home until your fever is resolved.
Yes. All right. Is there somebody else with a question? All right. At this time, if there are no other questions, we'd like to invite Justina. No, Gwen Ritchie. Gwen?
Can I ask just one more question?
Sure, Norma. Sorry, go ahead.
Okay, Dr. Bonamy, I see people wearing masks in the food store. I see people in areas where I go to exercise out in the open, walking or running and wearing masks. What is your take on that? And when should we wear masks?
I think
Now
that's quite,
that COVID is, sort of settled down.
I think that's quite fine. I mean, you don't know what those individuals' risk factor is. You don't know who's immunocompromised, who might be on chemotherapy, that sort of thing. We do know respiratory illnesses are pretty rampant in the country. COVID is still present. Flu is on the rise. We're gonna soon be talking about RSV again. So, mask wearing to me is not an issue. If you feel you're sick, masks do help to prevent you from spreading your illness to somebody else and vice versa. So I think that's fine.
Okay.
One last question.
Sure.
With reference to the flu shot. And I know they normally say like persons over 65 and young children should take it. But is it more highly recommended? Because until we know if this COVID thing has passed for the general populace, and what has been your experience as it relates to flu shots, period, the effectiveness of it.
So I recommend everyone over 6 months of age, honestly, to be vaccinated with influenza, so to take your flu shot. So what happens with the flu is the actual vaccine is made based on what we believe, honestly, that the flu virus is looking like. And that takes a lot of mathematical modeling, right? And so, for example, the last flu shot was pretty effective. So it prevented over 80% of severe illness if you were to get the flu. So that was pretty good. There are people in our community who, if they get the flu, they become really sick. So, for example, somebody with asthma, or somebody who's a chronic smoker, or somebody who has heart failure, or somebody who's over 65. A lot of those individuals, or somebody who's 90 and who's bedridden, and you come around them because you have the flu. So the flu shot has been shown to, one, prevent you from becoming severely ill, as well as secondly, prevent you from spreading the flu to other individuals. So it's important to take your flu shot every year. Again, I recommend everyone over 6 months of age to take to get their flu shot yearly.
So it does not compromise you from developing your own healing properties, your natural healing properties. Why it is so highly recommended?
Absolutely not. It does not compromise your immunity. That's what you're asking. It does not compromise your immune
No,
system.
I'm saying that, okay, my body would naturally heal and respond to certain things, right?
Correct.
You're saying that if I don't take it, yes, it improves my response if I do get it, but it isn't something that my body should naturally be able to heal from or react to.
You mean the flu itself?
The flu, yeah, the flu itself.
Yeah, definitely. So you can, people get the flu all the time.
Yes.
People get
And
the
that's
flu
why I was
all,
wondering about the flu shot, having to get it so often,
people get the flu
as it relates.
all the time. But the added benefit of, say your body can't protect itself, but the added benefit is that it prevents you from transmitting the flu to somebody who body can't recover if they get
Okay.
it.
Okay. All right.
Thank you. Gwen?
Good evening, all. Once again, Dr. Bonamy, I had the pleasure of meeting and interacting with you briefly recently when you treated my husband. So I was quite happy actually to be asked to do this vote of thanks. Your insights into the different aspects of the effects of COVID on the population, not just medically, but socially, economically, and even mentally, were, I thought, truly thoughtful, and they were well appreciated. You're obviously very well versed in this topic. And I also thought your response, your ideas on lessening the socio-economic disparity was good. We are so grateful that you took the time out of your schedule to speak to us. So on behalf of the Great Church of St. Ambrose and the Pastoral Care Committee, I want to say a profound thank you. Thank you for sharing.
Thank you for having me. Thank you for having me.
Thank you. And now if Father Brennan is on, we're asking him to do the closing prayer, please, Father. Don't forget to unmute. I thought I just saw him. Father Brennan. Oh, I don't see it again. All right, so can we pinch hit and ask Melinda Mackenzie, if you could just do the closing prayer for us, please? Melinda, if you don't mind. Unmute to do it. Melinda might be shy. All right. Heavenly Father, we just come before you and thank you for this delivery. We thank you for the work that's been put in by the doctors, nurses, medical professions. We thank you that they are dedicated and thank you that they're able to bring some sort of comfort to our hearts and minds in what was a tumultuous time and what continues to be a question mark. God, as we finish this day, we ask that you go before us, help us to understand that in whatever we do, we are serving you, honoring you, and glorifying your name. And now, Father, lighten our darkness, we pray, and by your great mercy, defend us from all perils and dangers of this night, through Jesus Christ our Lord. Amen.
Amen.
Thank you
Amen.
all for coming in, Dr. B. Lovely hearing a St. John's boy.
Yes.
Doing a
Green
good job.
Giant too.
Green, yeah, well, I taught him.
There
He's
you
in my
go.
class. I'll fight over him now. All right. Thank you, everybody. Have a good night.
Good night, all.
Good
We're
night.
off.
Good night all.
Good
Good
night.
night.
Doc, don't forget to stop sharing.